Hello, folks. Another update on the coronavirus situation here in Quincy. I know that we as a nation and a state are preparing and have been preparing and are executing a number of plans in response to this outbreak. I'm very fortunate to serve as mayor of Quincy. I get to work with some great, amazing public officials at all levels of government. And with me today is our Congressman, Stephen Lynch, who represents Quincy and a number of cities and towns, Boston South, West, and we're grateful for his involvement, his leadership, his continued support on any issue that we face. The Congressman called me the other day and checking in, what can we do, how are things going in Quincy? And that's not an act, that's him all the time. So today he joined us for a meeting. We had a meeting last week with some of the health providers, and the Congressman asked if he could join us and said absolutely. We had socio-medical and Man at Health, Brewster Ambulance, our chiefs of fire and police. We're also in touch with South Cove Health and BI Milton. They had an issue over there. Last minute they could not come to the meeting. So I know that we're facing a lot of situations where people are anxious, people are concerned, and a little bit afraid. Understandably so. But I think the programs and the edicts, if you will, from the CDC, from the governor, and by the way, the governor has been terrific, the lieutenant governor, really been awesome to work with as well. Maybe you could talk a little bit about what's happening at the federal level and how we interact with the state and municipalities.
Yeah, well, thank you, Mr. Mayor. It was good to sit in the cockpit today and watch your local response. You have a great team around you. We do. On the from the hospital, South Shore Hospital, Man at Health Center. And I know they have a Taunton and a Hull site, which is Hull is in my district as well. But they're really, along with the first responders, police, fire, EMS, really the front lines. So good to see them all there this morning. And you got like I said, you got a great team around you. And I hope that every city and town in my district is and across America is as proactive as you have been on this. What we're trying to do right now is to make sure that our mayors, our governors have the resources they need to get the job done. There's going to be, because of the delay in testing, we anticipate there's going to be a surge in numbers of positive cases. Right. And so there are a couple of things that have to happen. One, we have to make sure that those people we were with this morning, including our nurses and docs and healthcare personnel, including EMS, including police and fire, have the PPE, the personal protective equipment that allows them to deploy and get out into the field and do their jobs. That's number one. Number two, we have to have the tests that actually identify the people who have the disease and who have been infected or who may have been exposed to people who are positively identified. So you need to track those people and then quarantine them to stop the spread. So those two things, and as well as the public has to be part of this too. You can't be out there in big crowds. You've got to, limit your contacts as well. So we're trying to make sure that we have the resources that get to you and to the governor, so that those people, the first responders and healthcare people, can do their jobs. And then, of course, there's going to be some fairly significant economic impact, and we're working on that as well. So those are the first two things we've done. We put in $8.3 billion for coronavirus response, and then we did a Families First program that provides for, family medical leave, extended unemployment benefits, and other aid for small businesses to try to help cushion the impact that we know is going to come. Absolutely,
and that is really important stuff. We've learned from 9/11. We've learned from other unfortunate situations in our country. The immediacy, obviously, the health and welfare people immediately is first and foremost. But a lot of people live paycheck to paycheck, and putting food on the families on the table, as well as paying the rent and so forth. And we are looking at some local programs as well through Affordable Housing Trust Fund. We've actually asked the City Council to have an emergency meeting to take some of the snow and ice money, thank God we didn't have to spend, and put it over to an emergency response account as we migrate through this, or navigate through this, I should say. Who knows what's before us for expenses, so better to be prepared. So we're going to continue to do that. And what's interesting is that we've been doing these updates, but information changes almost by the hour. So
it does. It's extremely fluid. I mean, maybe
amazing.
you want to talk about where we are today in Quincy.
Well, she should be a doctor. She's as good as a doctor. Ruth Jones, our Commissioner of Public Health, has been just phenomenal, round the clock, her and her staff. And we've made the school nurses available to her as well while they're out to deal with the issue. We have 9 confirmed cases in Quincy. And we are handling that as prescribed by the CDC and the state. And we stay in touch with our first responders on what's happening out there. She'll call somebody at the firehouse at 3 a.m, let them know this is what's occurred, this is the address, just so that everybody is prepared. I think what you said is true. I think that the cases are going to all of a sudden explode. People are going to get real nervous. But the reality is, what the medical people are saying, there's probably people that have already had it, gone out of their system. So it's probably made a way through a lot of society anyway. So we shouldn't be shocked when we see the numbers going up.
Right.
Now, thank God, to date is minimum deaths, at least in Quincy. We're seeing the first elderly one with it, which is a tough one. We're hoping for him and praying for him. But all we can do is everything we possibly can on the ground, meet the demand as best we can. As we talked about today, the challenge is that personal protection equipment and then the testing situation. And I know that all levels of government are working their fannies off on getting that equipment to the local level as quickly as they can. We talked a little bit about today, and I had a meeting with my union representatives for both the police and fire yesterday, and some of their concerns. If a fireman goes down on a house, a whole crew in that house has to be sequestered, and so all of a sudden we could be looking at shortfalls and things. So you prepare for the worst and hope for the best.
Right.
I think that's the responsible way to do it. So we're obviously having you not only on the phone but actually coming down today to see us in this environment, letting people know what's going on. Our planning department's working with your staff on small business administration loans. We'll probably work with Tim Carroll with the chamber and try to help get the information out, help people to fill out the paperwork. Sometimes the biggest challenge, people take no offense, particularly with the feds, is the paperwork, page after page. But, I can't say enough about, again, your leadership. Governor Baker, Lieutenant Governor Polito, been great to work with, checking in all the time and trying to share the information as best we can and do what's right for people. We made the decision, as you learned today by coming into the hall, that we closed the hall and our public buildings to the public. That was a very hard decision for me because this is what we're here for.
Right.
But listening to the medical community, particularly the seniors, seem to be the ones that like to pay the bills in person.
Old habits
they don't
die
trust
hard.
the post office, I guess.
Come on, go easy on the post office now.
No, I just like to see that transaction in person.
Yeah, old habits.
So we're trying to protect them. Our phones are open, our websites, we're active on the computers and getting back to people on a regular basis, and we're doing things by appointment. We're just trying to be smart about it going forward. Obviously, the schools have been shut down, but we have grab-and-go meals at 4 of our school sites between 11 in the morning and noon for those families that need it. Come pick up a meal and to take it home and make sure that people are getting their nutrition. So, and that's a result of the federal program that you support at the federal level. We get the Title I programs and all. So I want the people to know we're working together, working very hard at this, trying to make it as safe as possible and get through this as quickly as possible. So maybe you could wrap it up, Congressman.
Yeah, it is. This is one team, one fight, right?
Yeah.
That's one of the nice things about this. Governor Baker, a Republican, and we're working side by side, hand in hand, on this issue. My hope is to get him as much resources as I can to deal with it on the ground here, and we're a team. So, I really, really do appreciate the level of cooperation and the forward thinking. You're anticipating this. Your team was anticipating this. Seems like everything's in place. As the situation grows worse, I just want people to realize that we're anticipating that as well. We're not sugarcoating this, and we're trying to put measures in place that will meet that challenge.
And finally, I saw today on the news you're talking about a major stimulus package that's being discussed now in Congress.
Right. So we're doing 3 bills. The first one will deal with nurses, first responders, docs, the healthcare system nationally. But we're also looking at small businesses and extended benefits for unemployment and also cash payments. We're also looking at some relief for the restaurant and services industries. Those are the tourism industry going to be impacted heavily. So and those are the first 3 coming up. We're even looking at ways that Congress can go into session and still abide by the limited gathering requirements. So, members of Congress will go down to the floor 30 at a time and vote. So we're sort of setting up a protocol that will allow us to comply with the social distancing requirements and yet still get our work done.
Well, again, I appreciate you stopping by today. I know you have our back down in D.C. We appreciate your leadership, your support, and your friendship, Congressman.
Well, thank you, Mayor.
So we have a Republican governor, we have a Democratic congressman, and an independent mayor here, all working together for the benefit of the public.
That's right.
Thanks so much, Congressman.
Thank you, Mr. Mayor.
Thanks for tuning in, folks. We'll be in touch soon.